My name is Dr. Michael Blizniak. I am an assistant professor in the School of Physical Therapy. What inspired me to pursue a career in physical therapy was probably growing up in my family. I really spent a lot of time with my dad growing up. He's a roofer, and so I worked a lot in high school to help support going skiing or having fun. And I was always around people that maybe didn't really have access to health care, didn't really want to go see health care, or always were saying things like, yeah, I threw my back out or my shoulder. I was like, oh, what does that actually really mean? And then, on my mom's side, I was lucky enough to have her as a nurse, and then her brother was a physical therapist. And so I was actually able to go and start shadowing and volunteering at a clinic that he owned. And then I was able to start to put the pieces together a little bit. Like, wow, I could learn this really good skill. I could go back and I could really help out, folks like my dad. And so that was something that was very, inspiring. My favorite part of being a physical therapist is that, in any given day, I can do multiple different things. And so I do bike fits on people. So I could do a bike fit on someone. They could be having pain that's coming from their neck, going down. They can't ride their bike anymore. Within an hour session, I can change their bike and they can be riding their bike. Same with running. I can do running analysis that's on someone. Make a small change, open up the world to someone's experience, interacting outside, running. We can see people that are post-op. And so if someone that has a surgery, that's about half the battle is right there. The other half is doing the rehab, following up. Your outcome is going to be much better. And so just that variety within a day, I think is probably the best thing about being a clinician. With therapy, you spend a lot of time with someone. They may start telling you about other things in their life. And so that gives you an opportunity to maybe look upstream or look a little more broadly than just, someone and their ankle. And so it allows you to connect people with different resources that may or may not be there. Sometimes you have to be creative, but if you're able to spend time and actually listen to people and really understand, what some of the troubles that they have, it's also more of like a preventative approach, and so you can pick up things that people may not have time to be picking up in a more fast-paced setting. And so the other thing is most physical therapists, usually have some type of lived experience, usually in the setting that they want to work in. Maybe someone that they know has had a neurological condition and it really drives them to want to be working in acute care setting, or maybe someone was an athlete or had an injury, or know someone that had something going on and then they couldn't work, and so they want to work in more of a rehab setting, long-term or an outpatient clinic. And so people have different experiences that really help, I think, provide a sense of understanding and motivation to really kind of help the person in front of them. So I think those things are probably true for all healthcare clinicians. It's just, you wrap in, if you want to be a physical therapist, if you like helping people move, well, then you'd probably gravitate towards that section of healthcare. I think the biggest thing that's unique about PNWU is probably our integrated clinical experience series that we have. And so of all the semesters that you have, there's really only one semester where you're not going to be actually interacting with a client that needs care. And so it starts out where you're off campus at one of our off-campus locations, like the Yakima Free Clinic or Yakima Neighborhood Health Service, where we see people that are under and uninsured. And those folks primarily have musculoskeletal impairments. And then on campus, in the second year, we see folks primarily with neurological conditions. And then in the fourth one, that again is going to be off campus as well. And so I don't know of any school that does, people could go up to 5 different locations to actually treat patients in their actual didactic coursework. And so I think that's quite incredible. I'm really happy to be here as a faculty member, and I really enjoy my time here. I think that comes from the students that want to be here. Everyone is attracted to the mission, and when we talk to people, it's very great energy when it comes towards helping people. And our graduates in our first year are fulfilling our outcomes of serving in rural regions.